Hey everybody, this is Miss Shoemaker. We're going to talk about sexually transmitted infections today. So this is exemplar 19.5. All right. So sexually transmitted, what are they? Of course, they're infections that are transmitted sexually. How are they transmitted? Any sexual act, okay? Well, sometimes it doesn't even have to be a sexual act, okay? But basically, any orifice, any mucous membrane, we could potentially get an STD. Okay, so risk factors, not using protection, not using barrier methods of contraception like condoms, many partners, and prevention is key. So abstinence, just like our mamas taught us. So the nurse's role in fostering reproductive health through STD education. So what should we do as nurses? Of course, we should help make sexually decision-making skills, especially for our young teenagers. My husband's a high school teacher, and I told him I want to come to your school and teach this, and he basically said, "Oh hell no!" And then my daughters are both in high school, and I said, "Can Mama come to your school and just asking them that totally embarrassed them. But um, I really do think they should, if we teach them not just sex ed, but also the repercussions, that unprotected sex may have, it might scare the death out of them, and they might, think about it. Um, Education about the body, encouraging active participation, strategies for safe choices if they are going to have intercourse. Emphasize protection, especially by latex condoms. Latex condoms are the best way of protecting against unwanted pregnancies as well as STDs, and we want to lubricate with water-based, not oil-based. Okay? Um, Lubricant. Oops. Sorry. Okay. So the first STD we're talking about is genital herpes. Okay, it's extremely contagious through the skin. It can enter minor breaks or scratches or abrasions through unaffected skin. Clinical manifestations. The patient, man or woman, has episodic outbreaks. They may have one or more clear, like blister-like vesicles, and these vesicles rupture, forming an extremely painful vesicle or blister. Okay, and these may the primary or initial outbreak um, is that erupts. Forms a painful ulcer after several days, and the ulcer may last up in 2 to 4 weeks if untreated. So this is caused by the HSV1 or HSV2. And you could see HSV, that means virus. Okay? So virus, we could treat the virus, but we can't get rid of it. Okay? Most people are asymptomatic initially, but the manifestations when they do have an outbreak, whether it's type 1 or type 2, is itching, tingling, appearance of the vesicles or blisters, dysuria, painful urination. So dys, that prefix dys is painful. They may have vaginal discharge. Okay. Medical management, we want to do a history and assessment of that visual inspection of that ulcer or sore, take a sample of that sore. And the blood tests which detect HSV1 or 2 may be helpful, but they're not always clear cut. And let me just let you know, the HSV1 is cold sores or fever blisters. HSV2 is herpes down below on the now, can HSV1 be transferred to the genital regions? Absolutely. So again, that's part of our teaching that we don't want to engage in any kind of oral intercourse if the partner has HSV1 or if we have HSV1. Okay, so not we, but you know what I mean. But um so um so that should oral intercourse should not be conducted as well. Some medications antiviral, not antibiotics. Again, this is a virus, HSV, ends in a V. So we're going to take antiviral medicines, and these antiviral medicines helps kind of speed the process up of healing, but the virus always remains in that body. It helps relieve the symptoms, suppressive therapy, and it helps also with abstinence. Or we want the patient to have abstinence, no intercourse during an outbreak. Again, the virus remains always in the body, but it can be triggered by stress, fever, sunburn, poor nutrition, menses, and sexual activity. Stress. There is no greater stress on the body than a woman making a baby in her body. Okay? She may not feel mentally stressed, but the body itself is under so much it's literally making another human being. Okay? So we don't want her to we want her to be cognizant that she may have an outbreak. Sunburn. Every darn summer, the first week out of school, I always get a fever blister. That's because I'm like, um, I'm loving the sun. I'm loving that we don't have school, and then I'm hating that fever blister I get the next week. But I get them from sun. Transmission from mama to baby. So if mom has an outbreak, she is going to need a C-section. So the C-section, of course, prevents transmission. Um, Greatest risk to the fetus is when mom contracts HSV in late pregnancy. Okay. And so we definitely want mama to have a C-section if she has an outbreak. So I love pictures. You're going to see all kinds of pictures. So HSV-1, of course, is cold sores. Okay. HSV 2 on the genital region. Okay. And you can see one here, one here, one here. All right. I already have a question for you. A patient has herpes simplex virus 2, HSV2. The nurse recognizes that which of the following should be included in the teaching the patient. So A, the virus causes cold sores of the lips. B, treatment is focused on relieving symptoms. C, the virus may be cured with antibiotics. Or D, the virus, when active, may not be contracted during intercourse. And your answer is B is in boy, of course. Treatment is focused on relieving those symptoms. So HSV2 causes genital herpes and is known to ascend the peripheral sensory nerves and remain inactive after infection, becoming active in a time of stress. Okay. All right. Now we're moving on to HPV. Ooh, we have another V. HPV, the human papilloma virus. This is the one of the most common viral STDs. It's transmitted primarily through intimate skin to skin contact, can be transmitted through a vaginal delivery. Depending on the amount, we may need a C-section. Okay, so the human papillomavirus is also called genital warts. Okay, so that means depending on the amount of warts, if they grow on top of each other and kind of look like cauliflower or broccoli, the woman may need a C-section. Okay. There is no cure for treatment. Again, ends in a V. It's a virus. But we can promote comfort and remove the virus, but I mean, remove the warts, but we're not removing the virus. So pathophysiology is grouped to low risk, intermediate risk, high risk. Okay. As we may or may not know from TV commercials, high risk can lead to cervical cancer. Okay. I have seen it so many times. All right, and it's in young women. I had a patient one time. She was 20. I think she just turned 23. At 22, she had a hysterectomy because she had invasive cervical cancer, and so at 22, she had a total hysterectomy because cervical cancer was invading. And then at 23, I had her as a patient, and she was given 2 weeks to live because of lung cancer. And basically, the ER doctor told her the the cancer that she had, which was initially cervical cancer, metastasized through her lungs. So even though she got rid of the uterus and the cervix, it metastasized too late. So she actually passed away at 23 years old. That's one of my points in nursing that I'll never forget. I'll never forget what she looks like. I'll never forget that patient. 23. Um, Clinical manifestations, the main thing is warts. It does not hurt. It's usually asymptomatic. Women need well, and men need routine screening. Women need pap tests, of course, to look for this. We may see um, Additional evidence is finding out to look for cancers of the vulva, the vagina, the anus, the penis for men, and some head and neck cancers as well. And again, I had a patient one time with neck cancer, and they were thinking it was caused by the HPV. They weren't sure at that time when I had her, but um, so it's just not a simple wart. So diagnosis for women, pap test, colposcopy. Colposcopy is a little bit more of an invasive pap test. Um, it the doctor paints the cervix with white vinegar, and the white vinegar makes the abnormal cells kind of a whitish color, and the doctor then biopsies that whitish colored tissue, and that's called a colposcopy. Can be done in the doctor's office just with a simple speculum, um, but that's a colposcopy. Clinical manifestations of HPV. Sometimes they're not clearly defined. We may not see any symptoms at all. Others complain of burning, itching, pain with genital lesions or warts. These warts are pink, white, or gray swellings depending on the patient's skin tone. On the vagina, the cervix, the penis, the scrotum, the anus, the perineal areas, they can have precancerous changes in that cervix, the vulva, the anus, or the penis as well. So it is imperative, honestly, for men and women to go see their doctor and for women to get their pap test. Okay. And what really drives me crazy, I'm going to go on another soapbox, but is that insurances are now changing women's pap test to every 3 years instead of yearly. And um, that drives me a little crazy. All right, HPV still treatment. Unfortunately, it is no cure because we know now that it ends in a V, the human papilloma virus. There is a vaccine against 4 types of HPV for young adults and teens. There's topical creams to help with the warts, cryosurgery or freezing or liquid nitrogen to kind of remove those warts, cauterization to burn the warts, surgery to remove the warts. But again, we are not removing the virus, just the wart. The virus always lives in the skin or the mucous membrane and usually causes really no symptoms. Again, condom use is strongly recommended because that's the excellent barrier method um, for HPV. All right. So here we have warts on the penis, another penis down here, bottom right. Here's the vagina. This is what I was talking about. Depending on the amount, a C-section may be necessary, and you can understand why now. Okay, looks like cauliflower. Okay, and does anybody know what body part this is? That, my friends, would be the anus. Okay, and so you could understand that that patient may have a little bit of pain or discomfort while having a bowel movement. All right, chlamydia. Also known as the clap. It's the most common bacterial STI in the United States, and according to the CDC, is the most common and fastest spreading STD. It's the leading cause of preventable infertility and ectopic pregnancy. That's right, preventable. Okay. How do we assess? We assess the culture the cells from the cervix, the urethra, or both. In women, it may be asymptomatic. The signs and symptoms may be asymptomatic, but we may see vaginal discharge and dysuria, which means painful urination. And at men, I should have also, it may be asymptomatic as well. But we may see urethritis and discharge from the penis. What are we going to do about it? So we are going to treat with doxycycline or azithromycin. In women, some complications may be pelvic inflammatory disease, and we're going to talk about that a little bit as we move on in this lecture. The pelvic inflammatory disease, also known as PID, it's when infection and inflammation move from the lower genital tract to the upper. And how about what does it do in pregnant women? So pregnant women, you should be screened, of course, for chlamydia at the beginning of pregnancy. If they are positive in the beginning of pregnancy, they will be screened later on in their pregnancy as well, just to make sure that it was properly treated. There is an increased risk of premature rupture of membranes, preterm labor, or delivery. And in the infant infected during a vaginal delivery may receive eye infections and pneumonia. And what is that eye medication that we give babies upon delivery? That's why we give them erythromycin in the eyes. That eye ointment helps prevent or treat prophylactically eye infections, especially chlamydia and gonorrhea. Just don't tell the parents that. All right, we got pictures. We got chlamydia. The photo on the left shows discharge from the penis, um, mucoid and watery. Um, and picture on the right is a view from the cervix through the speculum. So this is a patient's cervix. Okay. And of course, we got another penis here with discharge. Again, if a man is not ejaculating or urinating, nothing should be coming out of his penis like that. Okay. Nothing. Now, women, on the other hand, our bodies do make mucus. And so women tend to see maybe brush this off a little bit more because just through our cycles, women's bodies do make mucus. Men, they do not make mucus through their penis. So if men see this, they need to, of course, both men and women need to go to the doctor. But men are typically a little bit faster because they're not used to this. Women, we would brush it off as our normal body. All right, look at this map. So 2011 to 2020. 2011's on the left, 2020's on the right. The dark blue is the worst. Okay, so look at the South. The South as a whole, we have been progressing to blue and then darker blue. Okay. Louisiana has been always that dark blue. Come on, Louisiana. And Alaska. I guess Alaska's just too damn cold to do anything else. But so I would love to see an updated map. This is the most updated they had um, on the CDC website. But um, I would love to see the next United States a little lighter as a whole. Okay. And that really goes with education, education on the prevention, the spread, and also um, just protection. Chlamydia does have a best friend, though. And her name is gonorrhea. And gonorrhea is a gram-negative intracellular bacterium. And this is the second most common reported bacterial STD in the United States. Okay, it's transmitted by the skin and mucous membranes, also perinatal during delivery. Again, the signs and symptoms in males and females may be asymptomatic, but in males, we may see a burning sensation when urinating, so dysuria, a white, yellow, or green discharge from the penis. And the gentleman may also have painful or swollen testicles. Now, when a woman, again, may be asymptomatic, but she may have dysuria, increased vaginal discharge, vaginal bleeding between periods. Okay, a woman is a large carrier population, and this may cause pelvic inflammatory disease. All right. Now, other complications, this may cause sterility, epididymitis, and prostatitis in men as well. So, of course, we are going to treat this with his dual therapy of cephalosporins and azithromycin. Okay, and again, complications, pelvic inflammatory disease. We may even have a pelvic abscess, ectopic pregnancy, or infertility. Mhm. All right. Nursing management clinical manifestations include unusual vaginal bleeding or urethral drainage. Again, we're going to monitor vital signs, current signs and symptoms of that STI, urinary function, are they having or experiencing dysuria? Are they having rectal pain? That's not uncommon either. Vaginal bleeding or discharge from urinary meatus. And then also we know the effect on the pregnant woman and fetus. It may cause miscarriage, premature rupture of membranes, and premature delivery if untreated. And then if an infant contracts gonorrhea during a vaginal delivery, it can also infect those infant eyes and the joints and even causing life-threatening blood infections. So again, we're not going to deliver that mama vaginally if she does have gonorrhea, okay, or any STD, really. Here's again the cervix, the penis, the baby's eyes, okay? And this is gonorrhea of the infant eyes and of the throat. Yes. And so you're going to give everybody a side look when they say, I have a sore throat now. But not everybody has gonorrhea of the throat, but it can cause infection of the throat as well. All right. Whoa, look at that map. That is dark blue in 2020. Um I wonder if this is during the pandemic when nobody had anything else to do. No, I'm just joking. But again, Louisiana hanging strong, dark blue in both pictures. Come on, Louisiana. But look at even the Dakotas up here. I think they're the Dakotas. Um, but they're even dark blue. And so we just need to do better as a nation, honestly, with our prevention, our education, um, just to, lighten these colors. A male patient comes to the clinic and is diagnosed with gonorrhea. Which symptom most likely prompted him to seek medical attention? Painful red papules on the shaft of the penis, a foul smelling discharge from the penis, rashes on the palms of the hands and soles of the feet, or cauliflower like warts on the penis. So remember, this question's regarding gonorrhea. Okay. Now, I'll be honest with you. Anything, if he had A, B, C, or D, he would prompt go see medical attention. I guarantee it. But this question specifically about gonorrhea. So what prompted him? And the answer is B as in boy, foul smelling discharge from that penis. Okay. All right, let's talk about syphilis, shall we? All right, syphilis. The primary stage is caused by well, syphilis is caused by a spirochete. Okay, and in that primary stage, we usually see a painless canker. The canker is usually round, firm, small, and painless, and appears about 10 to 90 days after an infection. The complications, unfortunately, again, many women and men are asymptomatic for years, but they remain at risk for late complications if left untreated. So we're going to see how syphilis just kind of wreaks havoc on the whole body the longer it's in the body. Um, but in that primary stage, we'll see cankers develop at that point of entry. Okay. Unlike any other STD, syphilis is always a systemic disease. So here's that painless canker. Okay. This looks like it really hurts, but it's painless. Okay. So we need to and teach the importance of seeking treatment, and treatment is essential. It's essential to avoid progression. Again, it's a systemic disease, and we don't want it to become one. So prevention, manifestations, and transmission. So we want to reduce the number of partners, and we need to use barrier methods such as condoms. Safe sex can help decrease the transmission and occurrence of syphilis. This is, of course, another reportable STD. So we do need to report the history of infection to sexual partners and also and to health department as well. But we need the sexual partners um, so they stop spreading syphilis. All right. So here's those cankers. Again, they look extremely painful. Where is my cursor? Oh, hold on. Okay. Of course, we have a woman on the top, a woman on the bottom. And if she's not really paying attention, she may not be looking at herself. Okay. And so, again, because if they're painless, there's chances are she may not even know they're there. Okay. Now, a man, because of the penis being outward, he may notice the cankers a little bit quicker than a woman may. But those cankers really will go away soon. That's the scary thing, even without treatment. Okay. And secondary symptoms are going to appear. So secondary syphilis usually starts with the development of a rash. This rash isn't usually itchy. Okay. Um, we may see the rash on the palms of the hands, the soles of the feet. We may see it on the trunk. So the rashes associated with secondary syphilis will appear as the canker is healing or several weeks after that canker is healed and is gone. Okay. This rash is a maculopapular rash. It's kind of rough, red, reddish brown spots. Um, and um, again, many times on the trunk, the soles of the hands, bottoms of the feet. Okay. Patient these rash may last 4 to 12 weeks. And again, this is going to go away without treatment. So you have this patient that has a rash. They're not thinking syphilis. They may think of, oh, some kind of, maybe it's detergent. Maybe, they got, they broke out in some kind of hive or something. And they're going to get, change their detergent and get, Benadryl or something like that. It will eventually go away. And that's the scary thing. The patient may even have sore throat, flu-like symptoms, and oral mucus patches. Okay, so here's that rash of syphilis. This is the secondary syphilis rash. It's that macropapillary rash we see on the trunk, and we may see on the soles of the feet and the palms of the hands. Okay. Again, if not treated, if syphilis is not treated right here, it will progress to the next stage. Okay. The latent stage is a disease of more than 1 year's duration after infection. Okay. And then we'll see without treatment, the affected person will continue to have syphilis even when they don't have visible signs and symptoms. So they won't have any more cankers, they won't have rashes, okay? But the infection remains in the body, wreaking havoc, okay? Late syphilis will progress to tertiary syphilis, okay? This is when we see really havoc in our body. Tumors in the skin, bones, liver. Okay. We may see CNS and cardiovascular system being affected. It may be treated, but the damage may be irreversible. So let's say if syphilis causes cardiac damage, we may treat the actual syphilis. So we may treat the actual STI, but we may not be able to treat or cure the cardiac damage that syphilis caused, if that makes sense. So what are we going to do? We're going to gather data, do a physical assessment, look for any cankers, rashes, or anything of that nature. We'll do a blood test, a VDRL or RPR. Okay. Treatment, of course, is to get rid of it. And this, thank goodness, can be treated with penicillin. And if pregnant, if women are treated before the third trimesters, infants are not usually affected. So this is this is syphilis um, among pregnant women and reported cases of congenital syphilis. Okay, so the orange is pregnant women, and you could see we just keep getting worse with STDs as a nation. We just keep getting worse. So here, 2016, we're about 3,000. In 2020, we're about 6. Congenital syphilis is the blue. Okay, and unfortunately, that keeps going up, and that could so be prevented. Okay, um, let's look at the map. Oh Lord, we have a dark blue nation again in 2020. And I'm assuming, unfortunately, we're not getting any better. Okay. But look at Alaska. Alaska went from white in 2011 to dark blue. Okay. Um, and the whole United States became dark blue. There was not one dark blue state in 2011. Okay. So after teaching a group of students about sexually transmitted infections, the instructor determines that additional teaching is necessary when the students identify which STI is curable with treatment. Okay, we got syphilis, um, gonorrhea, chlamydia, and herpes. And then read the question again. The instructor determines that additional teaching is necessary when the student identifies which STI is curable with treatment. And we know D, as in dog, genital herpes is not curable with treatment. Okay? We could help the symptoms, but we cannot cure it because it ends in a V. It's the HSV. It's a virus. A client is diagnosed as being in the primary stage of syphilis. Which of the following would the nurse expect as a finding? Palmar rash, development of gumas, um, development of central nervous system lesions, and genital cankers or chancres, tomato, whatever you want to call them. Okay, we're talking about syphilis and we're talking about the primary stage of syphilis. And we know because the primary stage of syphilis, we're going to see D, genital cankers. Okay. All right, let's move on. So, pelvic inflammatory disease, I talked about this a little earlier, occurs when the organisms from the lower genital tract travel nice and up through that upper uterine cavity into the fallopian tubes, into the upper genital tract. And it may involve more than one pelvic structures, such as the uterus, the fallopian tubes, or any adjacent structures. Okay. Signs and symptoms include no pain to severe pain. Okay. Fever, unusual vaginal discharge with a foul odor, lower abdominal pain. All right. Um, it causes irreversible scarring. So, therefore, it may cause problems with fertility, especially if the scarring happens in the fallopian tubes. It is one of the leading causes of sterility. Okay. Also increases the number of ectopic pregnancies because of the scarring. All right. 2.5 million women in the United States have experienced this in their lifetime. Again, it's acute infection from the vagina or the cervix that ascends to the upper genital tract, infecting the uterus, fallopian tubes, and ovaries. Okay. I mentioned some of this earlier. We may see lower abdominal pain up that can be severe. Uterine tenderness, adnexal tenderness. What is that? What's that word? Adnexal. That's ovarian tenderness. Okay. Ovarian tenderness and cervical motion tenderness. We're going to rule out other causes, but we will treat with antibiotics. Hospitalization may be necessary if complications exist, because remember, this is traveling upward. So we got a lot of organs to really look at what it can cause problems to. Complications, chronic pelvic pain, infertility, and ectopic pregnancy. And I mentioned those. So, and although this is a drawing, you get the idea. This picture depicts the inflammation and scarring of the fallopian tube. So on the right is normal, healthy. On the left, of course, is a scarring and the strictures. We could see the swelling from the infection and inflammation. And so again, we're going to treat with antibiotics. We may need surgery to remove some of these adhesions. Okay. Other vaginal infections that we may see. Trichomonas. Trichomonas is a protozoal infection. Okay. It plays a big role in pelvic inflammatory disease and infertility. And the most common characteristics of trichomonas is malodorous, mucopurulent, green, frothy discharge. So I'll never forget the first time I saw trichomonas. So I was working in a OBGYN office, and the doctor put this woman complained of a lot of itching and odor. And so the doctor put the speculum in her vagina, and this green frothy discharge, like frothy, like the soap discharge came out of the speculum. And I'm like, oh, and I'm trying to keep a stoic face, and I'm thinking to myself, oh my goodness, what is that? The patient complained of itching and burning, dyspareunia, which is painful intercourse, and dysuria, which is painful urination, are common. Okay. It is diagnosed by microscopic visualization of the organism, and because it is protozoal, and of course, all partners should be treated. Okay. um, I'm just making sure. Okay. Bacterial vaginosis, also called as BV. This is the most another common cause of vaginal discharge. We'll see characteristics of thin, watery, gray like discharge, and this has a fishy odor. Okay, so this one is pretty distinctive because the fish odor. Candidiasis is yeast. Okay. It's just, again, this is a vaginal infection, not necessarily an STD. But predisposing factors for candidiasis are antibiotics, diabetes, pregnancy, obesity, high sugar diets, corticosteroids, and even immunosuppression. And we know that some the big complaints are itchiness, and we may see a cottage cheese like um, discharge. Oh, and let me just jump up to trichomonas. We call this trick for short because we're just too lazy, but we treat this with flagyl. All right. Pubic lice. All right. The transmission is most commonly spread during sexual activity. Also from infested sheets, blankets, towels, or clothes. Intense itching is that sign. So how do we treat this? With lice shampoo or lotion, but it will not go away without treatment. So we got to treat this. Okay. We need to help prevent and control the pubic lice, also known as crabs back in the day. Okay. Avoid having sex or sharing bedding, clothing with anyone with an infestation. All sexual partners, of course, must be treated because those little buggers, no pun intended. Well, maybe there's a little pun that was intended, but they'll be going back and forth. HIV. So HIV gradually destroys the immune system, which makes it harder for the bodies to fight infection. Causes are from sexual contact through blood or other bodily fluids. A pregnant woman can transmit it to her fetus through shared blood circulation or breast milk. Symptoms, okay, these symptoms are what's scary. Okay, diarrhea, fatigue, fever, muscle stiffness, aching, or swollen lymph glands. This sounds like the flu or common cold. Okay, um, um, exams or tests, the HIV ELISA or the HIV Western blot test, both must be positive to confirm the HIV infection. So that's the HIV ELISA, ELISA, and the HIV Western blot test. So, um, so the prevalence is, of course, globally. In the United States, I remember when this first became a thing back in the 80s, everybody was afraid to do anything. Afraid to sit on toilet seats, were afraid to touch people. Like, it was, um, it was just such a scary time. Lifestyle factors, of course, the we have to educate our patients on, of course, condom use. That is the best barrier method to prevent HIV. But just keep with one sexual partner. The drug use, of course, sharing needles. Um, is also a huge factor. The medical community, we may have great strides. So, when I graduated nursing school, everything was needles. Even connecting a mini bag, like an antibiotic to a main line, was with a needle. Okay, and we have come a long way with our needleless systems, thank goodness. So modes of transmission, of course, sexual, parental, um, um, perinatal. So we want to advise drug using patients not to share those needles. If this is not an option, then we instruct how to properly clean and disinfect. Okay, because they're not when a person's extremely addicted, they don't care. But if at least if we teach them how to properly clean, it may hopefully it may help. Okay. Also, there are needle exchange programs, especially in the bigger cities. Now, perinatally, there's a risk for perinatal transmission about 14 to 45% with each pregnancy because HIV can cross the placenta during pregnancy and exposure to blood or vaginal secretions and breast milk increase the risk for exposure to that baby. So absolutely no breastfeeding for this baby. Okay. Needle sticks and sharp injuries. There is a lag time between initial contact with an infected needle and the production of serum antibodies. It takes about 6 to 12 weeks. Okay. Of course, the CDC recommends the best prevention is to apply standard precautions for all patients. So, what about our pregnant women now? So, once diagnosed with HIV, treatment with oral antiviral meds will be given to maintain mom's health. We also will help prevent the baby from becoming infected. So, this means that during labor, mom will receive a loading dose of Retrovir IV, okay, followed by a continuous infusion until delivery. Once she delivers her baby, she will take Retrovir or ZVD in liquid form every 6 hours for 6 weeks. This is the baby. The baby will take liquid Retrovir every 6 hours for 6 weeks. That is extremely time consuming. This mom may need help with that. Okay, because mom may have other children at home. She's just postpartum herself. She may not be, feeling up to par. Every 6 hours for 6 weeks. That's a lot. And then mom herself will resume her antiviral medications by mouth, whatever she was on. So, of course, for HIV, we can't donate blood, plasma, or other blood products. Don't donate sperm, organs, or tissue. Don't engage in unprotected sexual activity. Inform all um, past and current partners, and inform healthcare of HIV status. So, what's going on here, right in our home? So, in 2019, Louisiana was ranked #1 in syphilis. Yay! #1 in congenital syphilis, #2 in chlamydia, and #3 in gonorrhea. That's sad. Okay, #1 in syphilis right here in Louisiana. So this is the HIV map of Louisiana. So the dark brown, of course, um, is the highest. Okay, and of Orleans Parish. Where's Baton Rouge? West Baton Rouge, East Baton Rouge looks a little bit lighter, but we got a lot of we have our very fair share of HIV. Okay, in this area. Um, of course, the best. I remember when I graduated nursing school, we were taught to treat everybody like they had an infectious disease. Okay, what does that mean? We wear gloves, of course, when necessary. When in doubt, wear gloves, and wash your hands between patients before and after care. That goes for every single patient that we will be in contact with. So, um, again, this is the average STD state rank. So, again, um, um, Louisiana is pretty dark red. Okay, and but this is the worst states for sexually transmitted disease, the new report says, which isn't really something to be proud of. Uh, Um, we could be better. And I hope when you guys graduate, wherever you guys work, we incorporate that into our admission teaching or discharge teaching, whatever kind of teaching that wherever department or field you may work in. But we do have something cool going on called the expedited partner therapy. This law passed in 2008. So this says when treating a patient diagnosed with gonorrhea and chlamydia, we can give the patient a prescription for the appropriate antibiotic for them and their partner, even in their absence of a physical exam. So that means that patient will go home with two antibiotic prescriptions, one for them and one for their partner. And that hopefully will help. Now, according to the maps, have it helped? Not really. I mean, we seem to be always shaded on the darker side, but that means that these people aren't doing it. Like they're not sharing this prescription. But um, we have to really stress the importance of these patients to really share these prescriptions if they're giving one. All right, a SATA, a select all. Let's yeah, okay. So and I know you're not nervous about this, so let's try this out. Teaching for patients with a sexually transmitted disease would include all that apply. So would we do A, treatment of sexual partner is important? Well, that's a no-brainer, duh. Yes, that's true. Would we do B, douching may help provide relief of itching? No. Douching may actually do the exact opposite that we want it to do. It may spread the infection or alter the local immune responses. Okay. So it is very contraindicated with patients with STDs. Okay. How about C? Should cotton undergarments be preferred over synthetic materials? Spandex or silk or something like that. Absolutely. How about D? Sexual abstinence is indicated during the communicable phase of the disease. True or false? Of course, that's true, right? And E, let's look at E. Condoms should be used during and as well as after treatment during sexual activity. True or false? Well, of course, that is true as well. So they're all true except for douching. B as in boy. We don't want to douche. Okay. All right, last one. A nurse is assessing a woman with vaginal discharge. A nurse suspects bacterial vaginosis when the client states which of the following. The discharge is yellowish but thin. Um, I notice a strange fishy odor during my period. The discharge almost looks like cottage cheese, or I've been experiencing some really intense itching. And the answer is B as in boy. Bacterial vaginosis is characterized by that fish-like odor that is particularly noticeable after sexual intercourse or during menstruation. Okay? All right, ladies and gentlemen. Thank you so much for listening. And you please, please, please reach out if you have any questions. Take care.